Question 1. A nurse is preparing to administer insulin to a diabetic patient. What is the priority safety check before giving the medication? A. Ask the patient if they took their morning dose. B. Assess the injection site for redness. C. Check the patient's blood glucose level. D. Determine the patient's meal preference. Answer. C. Check the patient's blood glucose level. Question 2. A nurse delegates the administration of oral medications to a UAP. Which action requires immediate correction? A. UAP reminds the patient to sit upright. B. UAP crushes an enteric-coated tablet. C. UAP gives the meds with water. D. UAP checks the patient's wristband. Answer. B. UAP crushes an enteric-coated tablet. Question 3. A patient receiving 4-heparin suddenly reports back pain and has a drop in blood pressure. What is the nurse's first action? A. Notify the healthcare provider. B. Stop the heparin infusion. C. Recheck the blood pressure in 15 minutes. D. Document the findings. Answer. B. Stop the heparin infusion. Question 4. Which action is not within the LPN scope during medication administration? A. Administering oral antihypertensives. B. Titrating for insulin based on sliding scale. C. Giving intramuscular antibiotics. D. Monitoring for side effects. Answer. B. Titrating for insulin based on sliding scale. Question 5. A nurse is giving a high alert medication. What action ensures the highest level of safety? A. Checking the MAR before administration. B. Asking the patient to confirm their name. C. Having another nurse verify the medication. D. Giving the drug with food. Answer. C. Having another nurse verify the medication. Question 6. A patient is prescribed warfarin. Which patient statement requires immediate education? A. I will avoid green leafy vegetables. B. I'll inform my dentist before any procedure. C. I can take aspirin if I have a headache. D. I will have my INR checked regularly. Answer. C. I can take aspirin if I have a headache. Question 7. What is the most important action when a nurse is unsure about a medication's dosage? A. Ask another nurse. B. Administer the medication as written. C. Look up the medication in the drug guide. D. Hold the dose until the provider is contacted. Answer. D. Hold the dose until the provider is contacted. Question 8. A nurse notices a medication error made on a previous shift. What is the best initial response? A. Notify the charge nurse immediately. B. Complete an incident report. C. Inform the patient. D. Document it in the nursing notes only. Answer. A. Notify the charge nurse immediately. Question 9. When is the best time to perform a second patient identifier before medication administration? A. After opening the medication package. B. While entering the patient's room. C. Just before administering the medication. D. After scanning the barcode. Answer. C. Just before administering the medication. Question 10. Which scenario reflects safe delegation of medication-related tasks? A. An RN asking an LPN to teach about new insulin. B. An RN asking a UAP to document for fluid intake. C. An RN assigning an LPN to administer a scheduled oral medication. D. An RN asking a UAP to assess for side effects. Answer. C. An RN assigning an LPN to administer a scheduled oral medication. Question 11. A nurse is preparing to administer digoxin. The apical pulse is 55 BPM. What should the nurse do first? A. Give the medication and monitor. B. Notify the healthcare provider. C. Recheck pulse in 15 minutes. D. Document and give medication later. Answer: B. Notify the healthcare provider. Question 12. A nurse receives an order for a medication dose that is higher than usual. What should the nurse do? A. Confirm the order with the pharmacist. B. Check the dose in a drug reference guide. C. Call the provider to clarify the order. D. Ask the charge nurse if it's correct. Answer: C. Call the provider to clarify the order. Question 13. A patient on opioids reports difficulty breathing and is drowsy. What is the priority action? A. Elevate the head of the bed. B. Notify the provider. C. Stop opioid administration. D. Administer naloxone. Answer: D. Administer naloxone. Question 14. Which of the following patients is most at risk for a medication error? A. A patient with dementia and no caregiver. B. A patient with mild hypertension. C. A patient on a single daily medication. D. A patient who asks many questions. Answer: A. A patient with dementia and no caregiver. Question 15. A patient asks why a nurse is scanning their armband before giving medication. What is the best response? A. It's part of hospital policy. B. It ensures your identity and correct medication. C. We are trying a new system. D. To reduce medication costs. Answer: B. It ensures your identity and correct medication. Question 16. A nurse is preparing to administer potassium chloride 4. What is the most critical safety measure? A. Dilute the drug in a secondary 4 bag. B. Administer the medication via 4 push. C. Avoid administering with other electrolytes. D. Infuse it at the fastest rate possible. Answer: A. Dilute the drug in a secondary 4 bag. Question 17. Which task should the RN not delegate to the LPN? A. Administering a topical antifungal. B. Monitoring for side effects of a new medication. C. Giving an oral diuretic. D. Teaching the patient about adverse effects of chemotherapy. Answer: D. Teaching the patient about adverse effects of chemotherapy. Question 18. Which action by a nurse shows safe practice in preventing look-alike/sound-alike medication errors? A. Relying on pharmacy labeling. B. Asking the patient which drug they usually take. C. Writing abbreviations clearly. D. Reading both the brand and generic names. Answer: D. Reading both the brand and generic names. Question 19. A nurse receives a verbal order for morphine. What is the next best step? A. Administer the dose immediately. B. Record the order and confirm later. C. Repeat the order back to the provider. D. Wait for the written order. Answer: C. Repeat the order back to the provider. Question 20. A nurse is administering medications through a nasogastric NG tube. What is the most important action to prevent interactions? A. Give all medications at once. B. Flush the tube between each medication. C. Crush all tablets together. D. Stop feeding 1 hour before and after. Answer: B. Flush the tube between each medication. Question 21. A nurse is preparing to administer a medication that requires monitoring for hepatotoxicity. What is the most important action before administration? A. Review the patient's intake and output record. B. Check the latest liver function test results. C. Assess for skin breakdown. D. Evaluate electrolyte levels. Answer: B. Check the latest liver function test results. Question 22. Which action demonstrates a nurse's understanding of medication reconciliation upon admission? A. Asking the family what medications the patient takes. B. Obtaining a list of current home medications from a patient. C. Relying on the pharmacy to input medication history. D. referring to the last hospital's discharge papers only. Answer: B. Obtaining a list of current home medications from the patient. Question 23. A nurse is giving a nephrotoxic drug to a patient with chronic kidney disease. Which lab value requires immediate action? A. BUN of 18 mg per deciliter. B. Creatinine of 3.2 mg per deciliter. C. Potassium of 4.2 milliequivalent/L. D. Hemoglobin of 13G/DL. Answer: B. Creatinine of 3.2 mg per deciliter. Question 24. What is the safest method to verify pediatric drug dosage? A. Use a drug reference guide. B. Ask the caregiver. C. Divide the adult dose by 2. D. Estimate based on child's age. Answer: A. Use a drug reference guide. Question 25. A nurse receives a stat order for 4-hydralazine. What is the first action the nurse should take? A. Call the pharmacist to confirm. B. Document the order. C. Check the patient's blood pressure. D. Prepare the medication. Answer: C. Check the patient's blood pressure. Question 26. Which behavior by a nurse reduces the risk of medication errors during high patient volume shifts? A. Multitasking during medication passes. B. Skipping the second check for routine meds. C. Using a quiet zone for med preparation. D. Asking UAPs to read medication labels. Answer: C. Using a quiet zone for med preparation. Question 27. What action should the nurse take when a patient refuses a prescribed medication? A. Discard the medication. B. Chart the refusal and notify the provider. C. Attempt to give the medication again later. D. Ask another nurse to give it. Answer: B. Chart the refusal and notify the provider. Question 28. Which order should the nurse question regarding medication abbreviations? A. Give 4 potassium 10 milliequivalent over 1 hour. B. Give Lasix 40 mg PO now. C. Give MSO 42 mg for every 4 hours. D. Give acetaminophen 500 mg every 6 hours. Answer: C. Give MSO 42 mg for every 4 hours. Question 29. Which factor increases the risk of adverse drug reactions in older adults? A. Increased kidney function. B. Decreased gastric pH. C. Polypharmacy. D. Rapid metabolism. Answer: C. Polypharmacy. Question 30. A patient receives an incorrect dose of insulin. What should the nurse do immediately after ensuring patient safety? A. Notify the provider. B. Report to the pharmacy. C. Call the charge nurse. D. Fill out an incident report. Answer: D. Fill out an incident report. Question 31. When administering medications through a feeding tube, the nurse should avoid which type of medication? A. Liquid acetaminophen. B. Enteric-coated tablets. C. Crushed oral antibiotics. D. Water-diluted electrolytes. Answer: B. Enteric-coated tablets. Question 32. A nurse receives a new order for a chemotherapy drug. What is the most appropriate action? A. Double-check the order with the provider. B. Administer in a patient's room with PPE. C. Ask the pharmacy to bring the medication. D. Refer administration to a certified oncology nurse. Answer: D. Refer administration to a certified oncology nurse. Question 33. A nurse must give 4 vancomycin to a patient. Which safety measure is essential before administration? A. Record the last dose time. B. Check for infusion site patency. C. Review electrolyte levels. D. Give rapidly over 10 minutes. Answer: B. Check for infusion site patency. Question 34. What is the best way to prevent medication interactions in a patient on multiple medications? A. Space doses 1 hour apart. B. Ask the patient to take medications separately. C. Perform a complete medication review. D. Advise the patient to drink more fluids. Answer. C. Perform a complete medication review. Question 35. A patient is given a medication via the wrong route. What is the nurse's first responsibility? A. Complete an incident report. B. Monitor the patient's response. C. Notify the provider. D. Report to the charge nurse. Answer. B. Monitor the patient's response. Question 36. A patient is allergic to penicillin. Which prescription should the nurse question? A. Clindamycin 300 mg PO. B. Ceftriaxone 1G4. C. Azithromycin 500 mg PO. D. Doxycycline 100 mg PO. Answer. B. Ceftriaxone 1G4. Question 37. Before administering a PRN pain medication, what should the nurse assess first? A. The last dose given. B. The patient's pain level. C. The provider's availability. D. The patient's vital signs. Answer. B. The patient's pain level. Question 38. A nurse observes another nurse giving a medication without scanning the barcode. What is the best initial response? A. Report to management immediately. B. Tell the nurse to document the med later. C. Encourage the nurse to follow safety protocols. D. Ignore the behavior if the medication is correct. Answer. C. Encourage the nurse to follow safety protocols. Question 39. A nurse is educating a patient about a new anticoagulant. Which statement indicates a need for further teaching? A. I will use a soft toothbrush. B. I can take herbal supplements for energy. C. I'll report any unusual bruising. D. I'll avoid contact sports. Answer. B. I can take herbal supplements for energy. Question 40. Which strategy is most effective in preventing medication errors in long-term care? A. Keeping medications at the bedside. B. Using handwritten medication records. C. Standardizing medication times. D. Allowing residents to self-administer unsupervised. Answer. C. Standardizing medication times. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.